A concussion is an injury to the brain that occurs after a direct impact like head-to-head or any trauma to the body that then transmits forces to the brain that can cause symptoms like headache, dizziness, and feeling off balance. There are red flags to a concussion, which are danger signs, and this is when you'd want to seek an emergency room evaluation. And that would be worsening symptoms, so a worsening headache, vomiting that's uncontrollable, as well as inability to recognize faces or objects. Also, loss of consciousness is also a danger sign of concussion. So these would be things that you'd want to get evaluated promptly. An athlete should be cleared by a medical physician prior to return to sport, and this should include a graduated return to play protocol where you're not just jumping right back into activity. The reason for this is your symptoms may reoccur as you're going through a graduated protocol, and you could end up with prolonged symptoms, prolonged recovery, and actually missing more of a season and potentially a worse injury. Awareness of a concussion has really benefited sports, and that's mostly by education. So if you are aware of what to look for, signs and symptoms of a concussion, and then are forthcoming about those symptoms, we can actually treat you and get you back to sport safely and more timely.